Care Queen Brenda here. Today we're going to talk about barrier creams, the different kinds, pros and cons of each, and what they're really used for. So barrier creams they create a barrier on the skin so that moisture such as urine doesn't get in the skin and cause breakdown. And then anywhere that there's moisture on the skin, where it's warm, moist, dark, yeast can grow. So you want to really protect that skin. So basically, anybody who's wearing a brief really could routinely use barrier cream when they have a brief on. Often I will walk into a facility and the caregivers say, "Oh, Brenda, I found out, Jane in room 7 has a red spot. So don't worry, I put some barrier cream on it." But what I think we have to differentiate is the difference between their use of barrier cream and the prevention of pressure. When we see red spots, that is usually due to pressure on the skin and signs of early breakdown. Nancy does this wonderful video called Think Pink, and you should see it. It talks about the different stages of pinkness, but it's pressure that you have to really, putting a barrier cream on a red spot can be helpful to protect the skin, but it doesn't relieve pressure. So again, barrier cream, I think anybody who wears a brief or who is consistently exposed to any moisture on their skin's really fragile, barrier cream is always a good thing to have on. Today we're going to talk about 3 different kinds. The first one is a zinc base, and it's thick and it's kind of heavy, and it really creates quite a good barrier, but it's really thick, and you can see my skin moving around to get it on, okay? And nurses have different preferences. Some like it really thick, some like it really thin. I don't think there's a right or wrong on that, but using it consistently is important. But when I go to pull off or clean off zinc, it pulls on the skin and it's kind of hard. It gets really messy and it can be really difficult to get it off. You can actually damage pulling on that skin trying to get off. Using something like a kitchen oil, shaving cream works, Vaseline works, rub it on there, and then this barrier cream just kind of melts off. So I think it has the thickest barrier, but it can be very messy, and it can be hard on the skin when you're putting it on and off. The next one is silicone-based barrier cream. It's kind of in the middle. It's much smoother, and they say that it's breathable. I'm not sure what they mean by that, but it goes on much smoother, a little bit thicker, and and you can move it around, and it's a little bit slick, so it kind of comes off pretty easily. I'm a fan of this one. And then the third one, which is my favorite, is a Vaseline or petroleum jelly based barrier cream. This certain one has aloe vera and some vitamins in it. I have to open it up. But it's by far my favorite. First of all, dermatologists really like petroleum-based products to protect the skin. And I like it because it goes on very smoothly. It's not messy. And when people do have pressure on their skin, and I tell them to use barrier cream on that pressure area, besides removing the pressure, I tell them massage the area 3 minutes, 3 times a day. And this creates a nice, good barrier that's not messy. So, and nurses have their preferences on which barrier creams they like, and we have pretty strong preferences. For me, I like the petroleum-based. Others swear by the zinc one. Hospice will provide you with a barrier cream that works, but use it consistently. And I wouldn't wait until you start seeing signs of red, irritated skin that's getting broken down due to moisture. If a person is in a brief, I would use it routinely. So I hope that's helped kind of clarify barrier creams and why they're used, which kinds there are, and again, just using something consistently, whatever your preferences are, is a good idea. You can click the link below to get a copy of our booklet, The Hospice Care Plan, to learn a lot more about bed care for the hospice patient. Thanks.